In this video, we will focus on vital signs. Vital signs consist of a blood pressure, lung sounds, heart rate, and respirations. Each of these vital signs will provide clues to the patroller on the patient's condition or an important step in administering medications during patient care. Establishing a baseline set of vitals on a critical patient is important patient care too. Patrollers will be able to determine if their patients become unstable or not, depending on the change in their blood pressure and heart rate. If the patient is stable, vital signs can be taken every 10 minutes. If our patient is or is becoming unstable, vital signs should be taken every 5 minutes. Vital signs are also important when it comes to certain medical protocols, especially when administering medications. It is important for patrollers to learn their state protocols and OEC protocols when it comes to administering certain medications and vital signs.
When looking for a pulse, you have several options. You can take your carotid, a brachial, which is on the inside of the arm. Radial is your most normal preferred method. It's located on the wrist, right behind the wrist bone. Take two fingers, set it right on the wrist bone on the upper end, look for the pulse. Once you find it, check on your watch. We're going to go for a full minute. We're checking quality and regularity of the pulse. With a pulse of 72 beats per minute, they were strong and regular.
We're going to talk about how to take a blood pressure. And to take blood pressure, you need a stethoscope and a blood pressure cuff. We have 4 different size blood pressure cuffs. There's infant, pediatric, adult, and large adult. And you want to use the proper blood pressure cuff for the age or size of your patient. We have an average size adult, so we'll just use the average adult blood pressure cuff. We'll put the mark for the artery over this indent in the arm. Get it nice and snug. Okay. And what I'm going to do is I'm going to put the stethoscope here, and then I'm going to turn the dial on the bulb, on the pressure bulb, to seal it so I can pressurize the cuff. And as I'll pressurize the cuff up to about 180 to 200, and then I'll turn the dial again to release the pressure, and I'll watch the dial and listen, and then I'll hear a pulse beat, and I'll record the pressure of that first pulse beat that I can hear, and then I continue to release the pressure, and then the pulse beat will stop, and when it stops, I'll record the last number and continue to just release it so I can take the cuff off. The first number is the systolic number. It's the higher number. And the lower number is the diastolic. So now I'm going to proceed. I can hear the beat. I can't hear the beat. I read a blood pressure of 140/80.
We're looking for counting respirations. it's a good idea to pretend that you're taking the pulse so that the patient doesn't know that you're watching and they change their breathing rate. Grab the wrist like you would be taking a pulse, and instead put your eyes on their chest for the rise and fall. Watching for a minute, you get about 16 breaths per minute with her. When checking lung sounds, use your stethoscope. There are 6 places to check. You have upper chest on either side, lower chest on either side, and then 2 spots on the back on your upper and upper on each side. Take your stethoscope so that they point forward when you put them into your ear. Put a finger on either side of your cover. Do not touch the top. Breathe deep. Breathe deep. We're looking for equal sounds on both sides. Breathe deep. Breathe deep. Breathe deep. And breathe deep. We're looking for presence and equality on both sides of the lungs.